see for Emma.
Good afternoon, Lord Brailsford.
Good afternoon, Miss Barami.
Thank you. My Lord, the next witness is Amanda Burnett.
Very good. If we could have the lady brought in, please.
Thank you.
Thank you. Now, good afternoon, Miss Burnett. Can you see me?
Yes, I can.
Can you hear me?
You.
Yeah.
Hello.
Right, make yourself comfortable, please, and Miss Brahma will ask you some questions. When you're ready, please.
Thank you, my Lord. Good afternoon, Mrs. Burnett.
Good afternoon.
Please could you confirm your full name?
I'm Amanda Jane Burnett.
Thank you. The inquiry has your details. Now, I would just remind you that a restriction order is in place. So while you can name your father and the hospitals that he visited and public figures, please don't name anyone else, including people involved in the care of your father. Okay, thank you. Now, you've provided a statement to the inquiry about your father, William Freeman. The statement reference for the record is SCI WT 0339501. Now, your father sadly died on the 17th of January 2021 at the age of 82 at the Queen Elizabeth Hospital.
That's right.
Thank you. Would you like to tell us a bit about your father?
My father was a wonderful man. He was a great father to my sister and I, and a wonderful grandfather to his 3 grandchildren. He was a very fit and healthy 82-year-old. He had always had an active and healthy life and enjoyed a long and happy retirement as well. He socialised a lot, took foreign holidays with my mum, and it was only in the last maybe 2 years of his life that his health started to fail a little bit, although physically strong.
Yeah. You started in 2019 to notice small changes in his behaviour, is that correct?
Yes, little changes in his moods and his reaction to things that would happen around him. Starting to lose words occasionally, not be able to finish sentences. So little things that initially we thought may just be a bit of depression or old age, but nothing that stopped him driving, living an independent life, going on holidays and socialising. But yeah, there was definitely something not quite right.
And you spoke to his GP about this, and the GP was concerned that it might be the start of dementia.
That's what the GP expressed when I rang, because my dad never needed to visit a doctor necessarily and didn't see himself as maybe having an issue. So I just wanted to have a conversation with the GP, who thought it might be the start of dementia. And ultimately it took us a little while to get the test done, though that wasn't offered for quite some time.
Okay. Yes, I understand that the GP made a referral to the memory clinic, and there was a plan for your father to have an MRI, but that these things were taking some time.
Yes, that's right. He'd had the initial, I think a lot of people will recognise the GP's test for dementia, which is a set of basic questions about dates and places, and he passed that with flying colours. But he was ultimately referred to the memory clinic, yes.
And the memory clinic, a couple of memory clinic appointments went ahead, but the MRI was cancelled because it was in March 2020. Is that correct?
Yes, so he had a couple of assessments and we were hopeful that the scan would go ahead, but as you say, that was cancelled and never rescheduled.
Okay. Your mother was advised that all non-urgent scans at that point were being cancelled?
Yes.
Okay. Yeah. So at that point in March 2020, with the pandemic taking hold and lockdowns starting, restrictions being put in place, your father remained undiagnosed and there was no support available to him?
That's right.
Yeah.
So,
And the GP didn't want to see your parents unless it was COVID related?
that's right. He didn't want to obviously see anybody unless it was an urgent case.
Mm-hmm. So given his undiagnosed dementia symptoms, how did the first lockdown affect your mother and father?
It was hard. I think it was hard for everybody. And as a family, we had to put systems in place to make sure that Mum and Dad stayed in a bubble. And I arranged an online food delivery so that I knew that food would be delivered. I do live nearby, so we quickly decided that our family would form an extended bubble so that we would be able to support them with whatever else they needed. But beyond that, it's an unknown, so we were very much, what can we put in place to ensure that they manage the best they can? But there's no denying that it was hard for my dad to appreciate what a lockdown actually meant in terms of how it affected his everyday life, because for someone with dementia, routine and familiarity are very important.
Did he want to be able to go outside?
He wanted to visit his cafes and his friends. We explained why he couldn't go to his favourite cafe, and we explained why he couldn't drop in and visit friends. He and Mum would go to their local shop masked, so they observed all the protocols, and that's just a 5-minute walk away. So he would do things like that, so at least that meant he could go out the house, but everything was so different at that time.
And at points, he would wander without anyone being aware, and you had to track him down and bring him back. What was that like for you in the absence of any help?
Incredibly difficult, and actually that wandering, I kind of debate that phrase wandering, because my dad walked with purpose. He knew where he was going. Very often he would turn up at my doorstep, but at 2 or 3 in the morning. So while he knew where he was going, he didn't really appreciate the time. So it was quite difficult for my mum and I to manage on our own with no support. We were not offered anything like door sensors or trackers by any services. In fact, the irony is that a lot of that equipment was offered to us the day after Dad went into hospital.
Thank you. You then go on in your statement to talk about restrictions easing in August 2020, and you, along with your parents, your family, your sister and her family, all went to the Crieff Hydro. What were your expectations of that trip, and what actually transpired?
So that trip was an opportunity when restrictions were less to get the family together. Obviously, my sister and her children had been separated from us geographically and legally for quite some time, and Mum and Dad had found that incredibly hard. So with discussion with my sister and I, we decided that this would be a kind of reaffirmance of family, a support to Mum with Dad, because they were living on their own in isolation for quite some time, and Mum also was elderly, so it felt like a rare opportunity for us to get together and remind Dad that we all loved him and that we were all a strong family. Unfortunately, Dad's health had deteriorated and his perception quite considerably at that point. So for someone who would normally thrive in that environment and enjoy the company of his children and his grandchildren, he was extremely anxious and agitated and couldn't enjoy it in the way we had hoped.
Yeah, thank you. And that actually led to you the following day driving your parents home. Is that correct?
So we were due to leave Crieff Hydro on the Sunday.
Okay.
And I drove with my husband, my mum and dad home, and dropped them off with another food package and made sure they were safe in the house and left them.
Okay.
But unfortunately, there was a crisis incident later that evening.
Your mother called you upset. Could you
So
tell
Mum
us?
had made, she phoned me, I think she'd phoned various members of the family to see who could pick up. She was extremely upset and alarmed because Dad had been trying to leave the house and it was late evening at this point. And she tried to discourage him, as she would often do, but he was quite a stubborn man when he put his mind to things. Mum had locked the doors and windows as advised by a charity worker.
Yeah.
That was the safest way to keep him in. I have my severe doubts about that. And Dad had tried to get out the house via a first floor window. So my mum was phoning in an absolute panic because this was an illogical behaviour from my dad.
What thoughts were in your mind when you heard that your dad was trying to climb out a first floor window?
Absolute horror. I couldn't believe it. And my mum was so distraught. I had to think very quickly on my feet. So I lived near enough that I could jump in the car, but not quick enough to get there to save had anything untoward happened. And obviously my mum was trying to discourage Dad and her life was at risk. On the way in the car, I phoned the mental health crisis number that I'd been given, and they said they couldn't help me, phone the police. So I phoned the police and they actually got there before me, and thankfully both my mum and dad were safe.
That's good. What did the police do? I understand they arrived and they made sure both your parents were safe, presumably de-escalated the situation. What did they then do?
So the police were able to instigate a red flag report. I'm not sure of the correct name for it, but they assured me that that report would go in first thing in the morning to trigger a social services response, which is what we desperately needed and was well overdue at that point.
Until that point, that had been refused to you because assessments hadn't been able to be, they hadn't been able to carry out assessments, so everything had been refused.
Yes, so nothing had actually been offered. Everything was on pause, and we had to manage as a family as best we could with no guidance or support or advice. So for the police to step in actually was the best thing that could have happened. But it was too late, unfortunately, because, as I say, all the social care response at that point came too late. That ship had sailed.
But following that report, the memory clinic staff agreed to visit your father. Is that correct? I appreciate, you believe that it should have come at an earlier point, but to establish the chronology of what happened, it was only after that point that they agreed to visit.
That's right. So the morning of the Monday, the police report had obviously been received, which triggered a phone call to me, and they said they would be visiting that afternoon to my mum and dad's address. Unfortunately, it was too short notice for me to change my work plans, so I was unable to be present. So I'm not able to give much detail in how the conversation unfolded with mum and dad, but on the phone call I received in the morning, the inference was that Mum should pack Dad an overnight bag because it was likely that they would want the consultant to assess him in person, and that would also benefit Mum in that it would give her maybe a night's respite from staying up all night to keep Dad in the house. So going into the meeting, that was my understanding, but how it unfolded was different.
Yes, because the staff member who attended initially said to your mum, well, this could all just be down to a UTI because that affects behaviour. And she said that whilst there was an assessment unit in Gartnavel Royal Hospital where your father could be assessed, she didn't think there was any need for that. Is that correct?
No, so she seemed to change her mind after visiting Mum and Dad, because when I phoned and spoke to Mum and asked how the meeting had gone, and they'd actually discussed 2 nurses driving Dad in because I wasn't available, but they'd left without him. So I was obviously a bit confused, as was Mum. She was actually quite upset that they decided that Dad was fit enough to stay home and again hadn't offered anything as an alternative support in the house for Mum going forward.
Thank you. And you weren't content with that view or position, so you asked for a consultant from Gartnavel to call you, and that consultant agreed with you that your father should be admitted.
That's right.
Your father then was admitted to Gartnavel, but had to be admitted in a ward which had elderly patients who had severe challenges, as there were no other options at that point. Is that correct?
That's right.
And you drove your parents to Gartnavel. Were you allowed to? You were allowed to enter the building, but you weren't allowed to go past a certain point?
That's right. It's Gartnavel Royal, which is within the campus of Gartnavel. So it's a separate building, and there are separate wards. And the ward that my dad was admitted to is locked, understandably, to keep people safe. And I was allowed to enter the building and accompany Mum and Dad to the doors, and then Mum was allowed to enter with Dad, masked, both, to go through the admittance process.
Okay. And on initially being admitted, your dad was told he had to isolate until a negative test result came back.
Yes.
Right. After the initial admission, were you allowed to visit?
No.
Was your mother allowed to visit?
Yes, when she was admitted, when Dad was admitted at the beginning of August, the tiers in Glasgow were such that Mum was allowed to visit, and that worked well face-to-face in the first month.
Thank you. Now, you then received a call from a doctor at Gartnavel who told you that they thought your father had both dementia and Alzheimer's, but they couldn't be more specific because still at that time they weren't carrying out scans. Is that correct?
Yes, it's still very vague.
Did anyone at Gartnavel provide you with regular updates about how your father was doing?
It was sporadic. As the days progressed, it became apparent that the onus was on us to ring in and get updates, and the consultant would phone with updates, not always weekly, but as close to weekly, I guess, as they could make it. The consultant wasn't based at Gartnavel, so he would go in and meet with the team, and they would review their patients. Right. It wasn't outlined to the family at the beginning how that process of engagement and communication would work. It never was. So it was very much ad hoc. So my sister and I learnt to phone at certain times, and some staff were better than others at giving fuller updates.
How did you find that, having at most weekly calls, and each time that you attempted to make contact, not knowing how much of an update you would get? How was that?
It was really it was incredibly frustrating and worrying because you're trying to fill in the gaps and you're trying to ask the right questions to elicit a fuller response in terms of our dad's care plan and treatment. And I think what also at the back of our minds was this was only ever a reaction to a crisis incident. This was only ever presented to us as a day or two respite and assessment. And as the weeks went on and we got closer to September and then beyond, it suddenly became horribly clear to us that there was more going on behind the scenes that we were not aware of and just not included in.
Thank you. During that time, were you able to have video or voice calls with your father?
So when Glasgow went up into a different tier in the beginning of September, and I think I say in my statement that I actually had to tell the hospital that when I rang in because I saw it on the news and I immediately thought of the implications for visiting. Zoom calls were facilitated. So we would try and do those every Saturday because I wasn't working, and I would facilitate a Zoom call, book a call with the hospital and mum and dad, and we were able to see one another, and I know my sister did the same.
Thank you. You go on in your statement to say that you asked about a potential discharge date for your father, and the suggestion was made by the consultant that a care home may be worth considering. And you did try to look at care home options, but it was difficult given the restrictions. But ultimately, you and your mother preferred for your father to be at home with a plan in place for carers to come in and help. Is that correct?
I think knowing what I know now, as well, you know, there should have been more choice available to us and more discussion about the next step. And while a care home would have been one choice, obviously our first choice would have been to get Dad back home, if that was medically suitable as well.
Yeah. Thank you. At one point, the doctor indicated that your father could be out for Christmas, but actually once Christmas arrived, they said that would be unlikely, as they thought at that point he needed 24-hour care. How was that, getting the news at that point? You've mentioned that you weren't routinely kept up to date with what was discussed.
This was the thing, so it didn't feel like a pathway in which the family was really engaged at any point. So it felt like decisions were being made or presented as this is the preference and this is what you should do. So that may have not been intentional, but because of the lack of communication and engagement at every point, it became difficult to have a meaningful discussion with the consultant about the next steps. And with the discharge date never being given and constantly pushed back, it was very hard to make plans. But as winter progressed and we all realised that the virus was circulating more freely and it was a new, more dangerous virus at that point, we felt as a family the tipping point had been reached where he was at more risk staying in a hospital environment than being potentially in a care home where he could receive visits from his wife in social distancing settings and would be less anxious and distressed at being parted from his family for what was coming up for 5 months.
And you tried to speak to the doctor about this, and you tried to explain to the doctor that you say in your statement, you tried to explain that your parents were in a position to facilitate care at home, but you were unable to change the doctor's view that that wouldn't be enough.
I think there were various discussions, and I am mindful that the consultant was obviously working hard to help Dad get to a point of discharge, but there was a lot of trialling new things and changing of medication and resetting. So we felt we were on a journey that we hadn't really signed up for. And it was becoming clear with every Zoom call that passed that my dad was more and more anxious and distressed. He was more bewildered at not being allowed to see his wife. And that's why my initial letters, which we may come to my MSP, were around visiting rights and the guidance, which has clear exemptions.
Yeah. Thank you. Now, in addition to the concerns around COVID and your father deteriorating, you had concerns about other patients in that ward. Is that correct? You were told, you say in your statement, you were told by a nurse that your father had been punched and kicked by a new patient. What were your thoughts at that point? And
absolute horror and devastation that the circumstances had led to my father being put in a situation where he would be assaulted.
At that point, was your mother still allowed to visit?
No.
Or that had all stopped?
That all stopped in September.
Yeah. Were they offering you garden visits or window visits or any kind of...
They were all denied. So I actively tried to engage them in conversations about what would work safely. And the benefit of Gartnavel Royal is that it does have a garden, an enclosed garden, but it's seen as beneficial to the patients, and you can imagine why it's beneficial for outdoor space and air, and it felt like that was an opportunity to work with families to do visits with masks, sitting at distance. And there are good examples of good practice of this throughout lockdowns that were very beneficial to dementia patients. So that was my argument, but it was rejected by Greater Glasgow Health Board, who denied my assertion that my dad was distressed and agitated and missing his family. And actually, the last Zoom call I had with my father, where he expressed if he couldn't see his family, he would rather be dead. And the nurse next to him specifically said to me, and I remember her saying at the time, "I'm going to note this on your father's notes." And I would imagine that she was also aware of the letters that I'd written.
Thank you. And you say in your statement that as you were trying to push for garden visits, there didn't seem to really be anyone who was in charge who could make that decision. You say that there was no real line of command in the ward or anyone to direct questions to. Was that a significant problem in your opinion?
It was an incredible block because although I had a dialogue with the consultant, I go back to the fact that there was no real obvious chain of command in the unit day to day, and I got to know nurses' names. Occasionally it was temporary staff, occasionally it was more regular names and voices, but nobody seemed to have a clear lead on the running of the unit. And then I latterly found out that a name that I'd been given when I wanted to address vaccinations, which we may come to, the name of that person, I was given an email, but they were actually shielding and not available. So
and
why
that was the manager?
Why I was given that name, I will never know.
Yeah. They hadn't been able to put anyone in place to cover for the manager while he or she was shielding?
I do not know why that was and why I was not given a clear lead on who was running that unit.
Now, while you weren't permitted garden visits, Gartnavel did invite musicians and artists into the garden to perform for the residents. How did you feel about that?
Incredibly angry. I felt it was insulting after the dialogue I'd been having about letting Mum and Dad see one another. In normal times, I can appreciate why a unit like Gartnavel would invite musicians and artists because it would benefit them creatively. But it was highly insulting in the lead up to Christmas to see pictures on their own social media feeds of musicians singing and playing in those gardens, and artists being invited in to decorate panes of windows with snowflakes. And I think I know what my dad would have preferred.
Yeah. Thank you. And of course, your mum still wasn't able to visit at this point. Were you able to have video calls at that point?
So the Zoom calls continued as much as we were able. Sometimes they were cancelled depending on technical availability and staff availability. But as much as we were able to, both sides tried to facilitate that. But it was with diminishing returns as the weeks went on, because my dad started to find them actually actively more distressing than beneficial. So you were getting to a point where you don't actively want to make things worse for your father by setting up a Zoom call which reminds him that he's still not allowed to see his wife or his children.
And could you see what impact isolation was having on your father? What was that impact?
He looked more drawn, his eyes looked more distressed. It was really visceral, the change in him, and it was almost like the spark had gone, because there was no hope. He really felt and verbalised that there was little hope because he wasn't with his family. What I did try to do was do the occasional phone call in between Zoom calls, which I felt might be more beneficial to him and not as distressing as having a staff member sit over his shoulder and hold him to the screen, because occasionally they would actually grab him by the arm and try and help him stay when he was distressed. So occasionally I would do phone calls, and he wanted to be home.
You mentioned in your statement that your mother had a power of attorney in respect of your dad. Do you think during the pandemic there was any benefit to having a power of attorney?
It was worthless. Absolutely pointless, because all the advocacy and the health and welfare rights that the person and their family are trying to enshrine were absolutely worthless.
Yeah.
There's absolutely nothing in that power of attorney that helped us.
And by this point, you still weren't allowed in. You mentioned in your statement that your dad just went into a black hole. Did you feel like you just didn't know what was happening because you weren't allowed in? What were the updates like at that point?
Sporadic. You know, they would be as basic as, your dad had a good breakfast today. Well, I would expect that's the least I would expect that he would have. Or your dad was pacing up and down a bit. Understandable. Your dad was a bit anxious last night. He didn't sleep very well. Not a huge surprise to me. nothing felt tangible in terms of treatment. I know in responses from Greater Glasgow Health Board, they would point to Dad not being distressed and putting on weight. But I didn't feel we were at any point having a really meaningful conversation about Dad's treatment in order to discharge him and potentially bring him back home, whether or not that meant via a care home initially, and that appealed because of the visiting, which I've touched on.
Yes.
And actually, I truly believe that had he been discharged earlier, he'd still be here today.
Thank you. And when the vaccinations started being rolled out, you were actually quite happy as your father fit into one of the priority groups. Was your father, in fact, given a vaccine as a priority?
No.
What happened?
So I think we were all overjoyed when we heard that there was a vaccine available, and immediately I was scanning to find out when they would be rolled out in Scotland and how the priority groups would be decided in conjunction with the JCVI. I downloaded a Scottish Government document which clearly outlaid the priority groups, and in December. So week commencing the 7th of December, wave 1 of the rollout was to include long-term inpatients of 80 and over. Dad did not get a vaccination, although all the staff and doctors around him in December received their vaccination, as you would rightly expect.
Yeah. When you questioned why he hadn't been given a vaccination, what was the response?
Nobody could tell me why.
Okay.
So I take from that it wasn't in their gift, but nobody escalated that question. Nobody sought to give me an answer. It was very much, we don't know, we understand your concern. Yes, we've all been vaccinated, and hopefully your dad will be soon too.
Did anyone try to facilitate a vaccination?
No.
Did the consultant try to do this? No.
No. And, you know, when you read in the newspapers that in wave 2, the 14th of December onwards, the first care home resident in Scotland was vaccinated. My dad was still sitting unvaccinated and never received a vaccine. And he was in a hospital. He was in a perfect location, and those around him were being vaccinated. I think what's also exasperating is that anecdotally I heard of NHS staff who were not patient-facing and were based at home being offered what they classed as spare doses.
You know, we've spoken about the lack of, your perception of there being a lack of command, a lack of chain of command. Do you think that if a manager had been put in place, if there had been a clear line of command, that perhaps that would have led to a vaccine being facilitated for your dad?
I think it could have been a possibility. We'll never know for sure, but absolutely the management, the impression I have, it couldn't have been any worse in terms of the way things were run, and it could have helped.
You go on to say that on Saturday, the 9th of January 2021, you had a Zoom call booked with your dad, but that you were actually contacted and told that your dad had COVID symptoms, and that was then confirmed a few days later. You had, of course, hoped that and initially been told that your dad might be out by that point. So it being then January and hearing that, how did you feel? What was What were the thoughts going through your mind?
So when I got that phone call, I was absolutely devastated. That's one of the moments that's very hard to clear from my mind, getting that phone call, because at that point, being told by a nurse that they suspect that there's COVID in the ward and that my dad is COVID positive and is being tested, this was everything that I had warned the unit was highly likely to happen in December. And that was everything that I had done my utmost to avoid. And here we were in the new year getting the phone call that Dad was being tested for COVID and was showing symptoms.
Yeah. What did you think of the policies and processes that were in place at Gartnavel?
It's hard to be specific, but and I can only talk about my experience of it, but completely haphazard and dependent on whichever person you spoke to at the time, and everyone seemed to have a slightly different approach to infection control.
Okay. Thank you. Now, after that, after the test result confirming that your father was positive for COVID, his symptoms continued to become worse. And when his oxygen saturation fell into the low 80s, a decision was then made to transfer him to the Queen Elizabeth University Hospital. Were you able to join your father in the ambulance for that transfer?
No.
Were you able to speak to anyone about what was going on at that point?
No. So the last call we got from Gartnavel was absolutely from a doctor to say that he'd made the decision to transfer Dad to the Queen Elizabeth. And we then were told the receiving unit that Dad would be going to, they thought, but everything's all a bit haphazard, as you will appreciate. And we didn't quite know what ward he ended up in. So the unfortunate thing is that when you phone Queen Elizabeth, it's a big hospital. So it's hard to locate somebody if you're not actually told where they are.
Yes.
So it took a while to locate him.
Thank you. Within 24 hours of being told that your dad had to be transferred, you received another call, this time about a DNA CPR notice. Could you tell us about that conversation?
Yes, I received a call, and this was from Dad's consultant who'd been treating him in Gartnavel. So I knew who it was, and what I wasn't expecting.
I'm sorry, we may have lost the link to Lord Brailsford.
I can see you, and I'm in communication through my PA with the technical people. Can you hear me?
Yes, we can hear you, Lord Brailsford.
I can assure you I'm still watching, and I can hear. Carry on.
Thank you, my lord.
And hopefully the technical people can find my picture somewhere in the ether.
Thank you. Please, Mrs. Burnett, if you wish to continue.
That's fine. So I received a call from my dad's consultant from Gartnavel. I was obviously desperate for an update, but it wasn't an update on Dad's condition. It very quickly unfolded that what he was seeking was DNR approval. So you can imagine my mind's going at 100 miles an hour trying to comprehend what's just happened to Dad, what the consultant is trying to explain to me, and what that actually means. So I had the conversation where the consultant was explaining to me why they felt that any intervention, should it be needed, would not benefit Dad.
Sorry, were they saying to you any intervention, or was it specifically CPR?
CPR came up because of the physical trauma. Sorry to be not more specific.
No, that's okay. It's, as you'll appreciate, this is an important topic that we are looking into. So was the conversation broader than CPR in the event of cardiac arrest? Were you being told that no treatment would be offered?
That was my reading of it, that my dad would not benefit should he survive this infection.
Mm-hmm. Thank you. Now, following that conversation, on the 13th of January, you finally managed to speak to someone at the Queen Elizabeth Hospital. Could you tell us about that conversation?
Yes, the doctor had obviously been certainly one of the doctors who was treating Dad in hospital. It was quite an unnerving conversation in itself, because your expectation with doctors is that they are calm under pressure and considered and will give you the best updates in terms of what they know. This doctor's demeanour was very flustered and is uncertain, and led me to be quite concerned about what was actually going on. He explained to me that Dad was quite distressed and that he wouldn't keep his mask on, and he was trying to change his gown. And I distinctly remember him saying to me, "I don't know what's wrong with him." And that stands out because it was such a strange thing for a doctor to be saying. So I said immediately, "Are you aware that my father is a dementia patient? Are you aware that he was transferred to you from Gartnavel?" Because I was trying to fill in any knowledge gaps that may be there in terms of how they were attempting to treat Dad. Because for a dementia patient, they absolutely need an advocate there. In the Queen Elizabeth, there are single rooms for a start. Dad would not be maybe aware of where he'd been moved to or why. So I could understand my dad's distress at a mask being put on him, and I think my dad's first instinct would be to get out the hospital and get home to his family. It was quite an unnerving conversation and not reassuring in any way.
Did the doctor know that, when you said that, did the doctor seem that he knew your dad had dementia?
He kind of glossed over it. He said, "I'll have a look at his notes," and he said, at that point, he kind of closed the conversation and said, "I'm very sorry." He obviously expressed that he was sorry about my dad's situation and that he would do his best for him, and closed the conversation.
And I think before that point, he told you that a chest X-ray showed that your father's lungs were severely damaged, and he told you that he was unlikely to survive.
Yes, again, the conversation thrust was, "We will make your dad as comfortable as possible," but it was, the thrust of that conversation was that the outcome would not be good.
Did you ask to be able to visit your father, given the information you'd just received?
Yes.
What was the response?
No.
You weren't offered or allowed any essential visits or end-of-life visits?
No. Not until the night before, not until the Friday, and that was maybe the Wednesday. But that was only because they thought they had only hours to live. So they rang my mother and said she may come in, and obviously that was a personal choice to her, and she chose to go in at that point.
Before that point, were you even offered video calls?
So no, because I had asked for that, knowing that they were not going to let us in, and while they do have iPads, it was locked up. and they weren't able to unlock it and find one for us. So for me, it felt like that was the last window of opportunity for any of the family to say goodbye to Dad while he was awake, and we didn't get that.
Now, you just mentioned that, and you didn't mention the date, but I think it was the 15th of January when they called and said that your father was unlikely to survive the night, and they said that your mum could visit, but only your mum. Is that correct?
Yes.
And what happened when your mum did? You said that she took up that visit. So what happened when she visited?
So I drove Mum to the Queen Elizabeth, and I walked her to the foyer, to the lifts, and sent her up in the lift to the level she needed to be. I'd arranged with a nurse to meet her at the other end, and they made up a makeshift bed for Mum in the same room as Dad, where she stayed till Dad passed on the 17th of January. So the nursing staff treated Mum with respect and kindness.
So you mentioned there until the 17th of January, so your father actually lasted a couple of days, and they allowed your mum to stay. What difference do you think that made for your parents?
All the difference. I fully believe that although Dad wasn't awake, I fully believe he could hear Mum's voice, because the fact that he held on until the 17th made me think that he heard Mum's voice, which is what he'd been so desperate to have, and to have her hand as well, because she was able to visit in person.
Yeah, thank you. Following your father's death, your mother had to self-isolate for a period of time. How did that impact her, having just lost her husband and not being able to be around family?
It was devastating, because what I had to do for Mum, she rang once Dad had passed, and the nursing staff got her a taxi home. Obviously, at the back of our mind had been the conversation we'd had with Mum that if you go in, there's a risk that you will contract COVID, and that didn't matter to her at that point. But what it did mean was she got a taxi home on her own. I drove to her home, and with a care package, knowing that she would have to go straight in and self-isolate, no hugs, no help, until we were sure she was safe. So I had to leave her at the doorstep and let this elderly woman who's just lost her husband walk into a dark house on her own.
You then go on in your statement to talk about the funeral arrangements for your father. Could you tell us about those arrangements?
Not easy, never easy for anybody. Particularly difficult to find a date for the crematorium to book us in, and then knowing that we would have to work within the restrictions at the time, who might be able to travel or should they travel, and who could facilitate a Zoom funeral, find the companies and the facilities and the processes, find a minister who was willing to come and take the ceremony. That wasn't easy either. Write a eulogy, and all the processes were really unusual. So obviously limited numbers and a very quick service, and coffin wheeled in, not carried in, with dignity.
Was there anything you would have liked to have done, or that would have been in accordance with your father's faith if he was religious, that you weren't able to do?
So Dad wasn't religious, but I think he would have liked to have thought we were able to give him a wake and send him off in style and share stories about what a warm and generous and kind man he was, and how much he'd done for his family over the years, how he never put himself first. Everybody else's welfare was always to the forefront. So we didn't have that opportunity to share stories and good memories. And in fact, we've still been unable to do that because we're on a pause, as a lot of bereaved families are.
And you mention in your statement that you've as yet been unable to scatter his ashes. Is that still the case?
That's right.
Okay. Thank you. Now, after your father passed away, his possessions were returned to you from the hospital. You were handed a bag of unopened letters. Could you tell us about that?
Yes, so obviously Dad died in Queen Elizabeth, but he'd been moved from Gartnavel unpredictably. So there were still belongings and items that needed collected. So my husband's offered to do that difficult job and received bin bags of clothing, not all Dad's. And in amongst the clothing were unopened cards and letters that family had written over the months.
So nobody had opened those? Did you expect that they would have been opened?
Absolutely. Absolutely. Why would you not open a card and put it by the side of somebody's bed? Why would you not open a letter with permission and read the contents if Dad wasn't able to read himself? But I think he could. But not to even open them and to then stuff them in a black bin bag with strangers' belongings. No way to receive your husband's effects. And in the coming weeks afterwards, when we challenged the hospital about that and received a kind of apology, Mum received mail with a scarf and other items with no covering notes and no warning. If they had just phoned me and said, we found something belonging to your dad, would you want to come and collect it?
Yes.
No, they'd rather put it in a jiffy bag and send it to Mum with no note so that you can just compound the devastation.
As part of that, you mentioned that you discovered that your dad's watch wasn't with his belongings. And you say that you had to go around the houses before they eventually found it. Is that correct?
That's right. So Dad had a watch that was very dear to him, and he'd always worn it since his 20s, and it was missing. He shouldn't have been admitted with it. It should have been locked up safely, and it wasn't for whatever reason, and we didn't realise that. And it was definitely missing. I couldn't locate it anywhere. So Gartnavel told me that he had never worn a watch and they didn't know anything about a watch. They then changed their mind and said that they'd seen Dad wearing the watch when he left for Queen Elizabeth Hospital. I then phoned Queen Elizabeth, and as you can imagine, it was put to quite a few people. I just felt it was really important because it's only a watch, but it was a personal effect and it was personal to him, and Mum would have wanted it back. So I persevered, and I eventually called Lost Property at Gartnavel, and I described the watch, and they said, oh, that fits a description of a watch that we've had for quite some months. And they sent me a photo of it, and I was able to confirm very quickly that it was my dad's watch, and it'd been sitting only yards from the unit where he'd been for 5 months. So I was able to collect it, but it felt like a really disrespectful way to disregard and also to mislead me in terms of whether he had the watch or not.
You then went on ultimately to make a complaint about Gartnavel, about the treatment, the lack of visitation, and the failure to vaccinate your father.
Yes.
What was the response you received? Were you satisfied with that response?
No, I wasn't satisfied with the response. As regards the visiting rights, it clearly said in the Scottish Government guidelines that where a dementia patient is caused distress, those are the kind of exemptions that should be made and taken into account, and that was totally disregarded or denied by whoever made the decision. Greater Glasgow Health Boards, it was the Chief Executive who wrote back to me via my MSP. As regards the vaccine, they wrote back to me and I was not satisfied, so I pushed back again and eventually got a response about the vaccine rollout and was told that they didn't give the vaccines in Gartnavel until the 3rd of February 2021. Too late for Dad, and incredibly late given I go back to the Wave 1 guidelines where week commencing the 7th of December, Dad would have been priority.
Thank you. Please, could you tell us about the impact losing your dad has had on your mother?
It's been awful. She's really been broken. My mum is a very strong and independent and optimistic woman, very capable, and they were a great team. But Mum lost her partner of many years and in terrible circumstances, and was denied the chance to give my dad comfort in the last few weeks of his life. And I do think there were many missed opportunities where there were examples of good practice in interpreting the guidelines and keeping people safe, but also having some humanity. And I hope that's taken into account when the inquiry comes to issue its findings.
Thank you. What has the impact been on you and your family?
It's been huge. There's just before and after. And I think we're still working our way through that in our own different ways. But without exception, it's affected every single member of my family incredibly hard, and that's still manifesting itself for the young and the older.
Thank you. You go on to comment on, make suggestions about lessons that should be learned. Please, could you read paragraphs 120 to 122 of your statement, please?
I've got 116 to 118 here with lessons learned.
Okay. Oh, apologies, my copy seems to be paginated or numbered differently. If you could read 116 to 118, please.
So lessons learned. There should have been a plan for what would happen in the event of a pandemic. Nobody had thought about the day-to-day management for patients like Dad. No one thought about the impact of shutting down clinics, scans and GPs. We need a plan for how to manage a pandemic situation and protect vulnerable patients, but also balance human rights and welfare so they are not made worse. Whether it was due to a lack of experience or genuine fear, it felt like there was no sense of real leadership. The tier system, in my opinion, was ridiculous because it had no real nuance for situations like the one my dad was in. Dad became vulnerable through circumstance. If he and my mum had been able to access important care and support while at home, we would not have had to react to a crisis incident with a hugely disproportionate impact on Dad's freedom and right to be in the care of his loved ones.
Thank you. Is there anything that we haven't covered today that you would like to mention?
I don't think so. I think we've covered everything. I just want to reiterate that my dad was a gentleman of great compassion, strength and dignity. I know he would want to ensure that he'd done everything he could do to help others avoid such pain. My family and I are here today to do our best for him and all the others lost to COVID-19.
Thank you very much.
Thank you.
Yes, very good. Thank you very much indeed. Now, we'll take about 15 minutes, Ms. Brownie.
Thank you, my lord. Yes.
Very good. Thank you.
My Lord, the next witness is Lee Dodds.
Very good. Thank you very much indeed. Can we have the witness in?
Thank you. Good afternoon, Mr. Dodds. Please could you confirm your full name?
Lee Dodds.
Thank you, and the inquiry has your details. I must remind you that a restriction order is in place, so while you may name your son, Ayr Hospital and public figures, please don't name anybody else. Now, you've provided us with a statement about your son, Lee James Dodds. That statement reference for the record is SCI WT 0386501. Now, your son sadly died on Friday, the 2nd of April 2021, at the age of just 32.
Yes.
Okay. He lived with his wife and their 2 children. Would you like to tell us a bit about your son?
Yes. Well, we had him, obviously, I think it was the end, no, we were getting half a year. No. He was the second. My wife was pregnant before, lost the first one at 18 weeks, miscarried, and then when he came along, he was the world. We looked after him, brought him up the correct way, in every way, and he was fantastic. Ken, just as a child, it was great fun. And when he got older than that, it was even better because he was going to do football with me. I got my season ticket when he was 2 years old to go to Ibrox. And it was fun. Every weekend we'd go. So then he ended up getting married. He got married in Mexico, Cancun.
Okay.
I can't say her name, but his wife had a great life. He looked after him, that's the kind of person he was. He was absolutely devoted to her and that. And then his grandson, my grandson, he came along. And then about 4 years later that, then my granddaughter, she came along. And when Lee passed away, his grandson was 10, my granddaughter was 6. And I always remember going in after he passed away to tell them. And he says, grandson says to me, "Why did my dad lie to me?" And I'm like, "What?" He says, why did my dad lie to me? I says, "What did he say?" And he says to us, I'll not be that long, son. I'm coming back. He promised me he would come back to me. And I had to tell him, and that's one of the hardest things I had to do, to sit the two of them down and tell them what happened. I say, your dad fought it, but he couldn't. It was just too big a problem for him. It was too big a job to try and survive. And
Mr. Dodds, would you like to continue?
Yes. Lee James, he was our world. And his mother was so proud of him. She bought him the big Silver Cross pram. She walked every single day with him, everywhere, every day. And when he was born, we bought the camcorder. And we recorded every single Christmas from his birth to his death. And we've still got them. We absolutely loved Christmas. And he always wanted the tree up early, no, December. So that was okay. And then when he flew the coop, he got his own way. Tree was up November. He taken his children round about all the Christmas shops, as like he did. He taken them to Roselle Park to see the reindeers every Christmas Eve, same as what he did. And he adored them. He adored the three of them. He adored them. Then when he left school, I put out his CV all around the council, and he got a job, plasterer, South Ayrshire Council. And that's where he was till he passed away. And they were brilliant, the workers and that, so it was just hard when he got that, but it was the best I could ask for. Definitely the best. Couldn't get any better.
Thank you. Now, your son had asthma, but that was well managed.
Yes.
And other than that, he didn't have any health conditions.
No.
Is that correct? And in fact, he didn't ever receive a letter requiring him to shield.
No, none.
And as you've mentioned, he worked for the local authority as a plasterer. But he had some concerns about the working practices, and he wrote to one of the local councillors about his concerns for non-essential workers, such as plasterers. Did he receive a response to that?
He did for the councillor, yes. He responded with an email telling him that he was passing it on to HR.
Okay.
And that he would get back to them. And that was it. I says, that's funny. He says, nothing else after that.
Did you follow up then?
Yes, I'll get into his emails and I've seen the emails. So I started sending it to the councillor. And he got back to me and he says, I'll find out. And then he wrote back, he emailed me back saying, oh wait a minute, I've just remembered it was a phone call. And that was that. I says, right, okay, so I contacted the person, HR, told them what it was all about, what happened and everything like that, and he got back to me, and it was just a quick, I cannot give you any information. And that was that.
That was it.
But I kept it at him, not at him, but I set it into because he told me I had to go through the data protection.
Okay.
So that's what I did that way, but they were coming up with the same. They gave me some information, but nothing about Lee. He was on a phone call because somebody from HR had phoned his foreman, and his foreman phoned Lee to ask him what medication he was on.
Okay.
And 2 hours after it, HR called, because he told him what he was on, the medication he was on, and says, you're fit enough to come back to work the Friday, and this was on the Thursday, because he was to start work next day.
Was the medication just asthma medication?
Yes.
Yeah. So he was told that he had to go back to work anyway.
And that's when
because
he sent that to the councillor.
Okay.
Because they were wanting him back. See, he was a plasterer, but there was a few times he was off doing the plastering with the stewer. If there was a lot of stewer and that,
Okay.
get into him, that he had to stop, had to take a couple of days off to get back.
Okay.
But other than that, he managed it.
Yeah. And he was told that he would be working in empty houses, and so that justified him going back, even though other tradesmen were also present in those houses. Do you know if they were able to maintain a 2-metre distance?
Leaving in.
Okay.
He just told them up, say, I'm not getting in there. He said, there's too many workers in the one house, they shouldn't be there, I'm going to the next job.
Okay.
But
so he tried to keep himself safe?
Oh, definitely. He tried to keep himself safe, but he tried to keep me and his wife, his mother, safe as well, because that's what he was worried about. He followed all the restrictions to protect his family.
Yeah. You go on in paragraph 8 of your statement to raise the point that all staff were sent back into classrooms on the 22nd of February 2021 prior to staff being vaccinated, despite their union asking for vaccinations before their return to the classroom.
Yes.
Your daughter-in-law worked as an early years practitioner.
Yes.
So she was asked to go back. Following, you say at this point in your statement that following your son's death, you contacted multiple officials to complain, and the response, and you received a response from the Scottish Minister Special Advisor, essentially stating that they had to balance the risk of COVID transmission with the risk posed by other harms. Is that correct?
That's correct, yes.
Yeah. And following the return to the classroom on the 7th of March, just shortly really after returning, 7th of March 2021, your daughter-in-law received a call advising her that 2 colleagues in her bubble had tested positive for COVID and that she should be tested.
That's correct, yes.
So she arranged for a test, as did your son and one of your grandchildren, and it transpired that they were all positive for COVID.
The full house had it.
And they isolated at home. But while your daughter-in-law and grandchildren seemed to be recovering, your son was deteriorating. Is that correct?
That's correct, yes.
Thank you. Now, 5 days after testing positive on the 13th of March 2021, you say that your son was struggling to breathe, he couldn't speak, and his heart was racing. Your daughter-in-law, I believe, called for advice, and they were told to attend at University Hospital Cross House.
COVID assessment unit, yes.
Yeah. And you say that he was taken into hospital by a woman wearing no PPE. Is that right?
She came out they weren't allowed near the hospital, so she came out to the car, walks him in.
Yeah, and nobody was allowed to accompany him in.
No way.
And you say there they gave him steroids to open his lungs and decrease his heart rate, then sent him home with a leaflet about circumstances in which to go back.
Yes.
What did you think of that?
Well, at the time, we didn't know nothing, what was on, what they said to him or anything like that, because he wasn't right there. And that was day 5 of COVID. And he comes out and he basically he couldn't tell you. He just gave him the steroids to help open up his lungs and to help his heartbeat. And that was that. They sent him home, but it was after we got the documents that we asked for, we couldn't believe what we were reading. Couldn't believe it. And also go back to when his wife caught it. Nicola Sturgeon, she decided on the 16th of February that go back to the classrooms, even though that week there was still 324 deaths a week. And she says, we'll send them back on the 22nd of February. And then that week there was 227 deaths. 227 deaths when they sent them back. And they thought that acceptable. And I don't understand that. How's that acceptable? It was, especially after the unions had asked that all staff in the premises should have been vaccinated, and was refused. And then that was what it was, about the 8th, 9th day she was back in the classroom. She's got COVID. And if this is a deprived area that she was working in, and they don't go with the rules down there. So this was bound to happen. Lee actually spoke to his wife before they went back and told me about that. See that area? He said, you want to see them? They're in and out people's houses. The Waynes are out playing with one, and they're in and out through houses. He said, unbelievable. So, but she was told she had to go back. And that was at,
Yeah.
when we read this, I don't know where you want to go with this just now, the 13th, where they said that once he passed away, and he was diagnosed with a wheeze throughout all zones.
Okay.
He was diagnosed worsening COVID and exacerbating asthma.
Okay.
And they never even x-rayed him.
Okay.
Never x-rayed him.
These were recorded.
He's asthmatic. And a wheeze throughout all zones and other problems. And it's there what his wife actually said, told them. And none of that was taken into consideration.
So they recorded this, that there was a wheeze throughout, and the other symptoms you mentioned, they recorded that on the 13th of March, the day that they discharged him with steroids. Well,
yes.
He hadn't been admitted to be discharged, but the day they sent him away
home
with steroids. And after going home over the next few days, he unfortunately deteriorated further.
Yes.
Did you see him during that time?
Yes. We went over to his house and we stood outside because before he was that bad, he came over. He was at a walk with family, and he came by and he phoned us. He says, we're outside. So we went outside to see them. They were out in pain, we were in the garden. We just spoke to him that, and then they said they went away, I walked back home because they couldn't go anywhere. They were still allowed to go out and walk. So we did see him, and we did go over. I popped by through a few times because I was just out and about.
My lord, I understand the breach has now been taken out.
Yeah, good. Very good. Thank you. On you go then.
Thank you.
His wife called us on the way up to the hospital to tell us that she was taking him up.
Okay.
So we weren't there both times. And the second time he was up, obviously we didn't see him that day, but she gave a good account of what was going on. That the bed was soaking wet, he wasn't eating, he wasn't sleeping, he was getting agitated. He was sitting for 3 days, never spoke for 3 days.
Okay.
And he was just staring. And I don't know with what his wife said and what she put down there, I don't know how they could do that, knowing he's asthmatic and they're getting all this evidence here and they don't x-ray him.
And in fact, when he attended on the 16th of March, they gave him cocodamol to bring down the temperature to his fever, and told him to continue with the steroids. You had asked, and presumably this was via telephone through his wife, you had asked for the steroid dose to be decreased, and as you thought it was affecting his sleep, and they agreed to this, is that right?
No, I think that was his wife.
Right,
And I thought
okay.
it was his
It's
wife.
possibly just how it's noted down in the
Yes.
statement. Okay, and after being given cocodamol and told to carry on with steroids, he was sent home again.
Yes, and
At that time, did you think his symptoms were being adequately addressed?
No.
Were you? Okay.
was-
Following... Oh,
it was
apologies.
in one page at the end, that the 16th, when they put down, and I don't know why, I'm trying to find that there, question marks to that about the steroids,
Okay.
whether he should come off them or no. They didn't know. And I'm just trying to find it here. My diagnosis, question mark, sleep affected by prednisolone, question mark, due to worsening nocturnal asthma. And I'm saying, what do they mean by that? Are they saying, we think, we don't know? And they're just saying that.
Could it be that they're saying that's open medically? I appreciate that's questionable. That's something
Questionable,
which
yes.
There may be a divergence of medical opinion, or
Well, that's what we thought it says, but why then? Because we found out after that they were gone by protocol and guidelines. And this is when we went to a meeting with the health board. And I always told them, I says, protocol and guidelines, that's what they are. They're only guidelines. If you see somebody asthmatic being twice, this is the second time there, I says, in the state he was in, and his wife's there, you have to x-ray him. Why not x-ray him? But it says, we follow that, so protocol and guidelines, that was it. But I said, no, you have to go outside the box. If you see something, you have to think. But no, they stuck by their methods.
Following on from that, given her concerns, your daughter-in-law bought an oxygen monitor for your son.
Yes.
And the following day, his oxygen saturation was at just 85%. For context, are you aware that the standard acceptable saturation tends to be around 93, 94? And he was at 85. Was your daughter-in-law concerned at that point?
Yes, because she phoned friends and medical people she knew, and they told her straight away, phone an ambulance now. Now, phone it. And she's like, why? I said, just hang up and phone an ambulance.
What happened when she called for the ambulance?
It was rejected.
What did they say?
It doesn't fit the requirement for a blue light.
Okay. And what was the criteria?
Well, then they said to her, he says, but if you phone, we'll send one out. But it could be an hour, 2, 3, 4, whatever. And they says, if you phone your GP, and that's what she did.
What did they expect her to do in the meantime about low oxygen saturation?
I don't know. They never said.
Okay.
And she asked them that, and they just never answered it.
What was the response from the GP when your daughter-in-law contacted them?
She called a blue light ambulance straight away.
The GP?
The GP, yes.
And
the call record states that she told them, I want them taken up to Air COVID assessment unit and admitted. She also called the hospital and told them that he'd be on his way up shortly, and the history of what he's been through.
And despite her making those concerns known, the ambulance took 42 minutes to arrive. Is that correct? You say in your statement that the paramedics attended. They took a history and they checked your son's statistics. At that point, his oxygen saturation had gone up to 96%, which is within the normal
Because he'd been sitting
range.
up for 40 minutes, he was lying in bed. We got him downstairs, and he'd been sitting there for that, and he was like this, just waiting.
And because his oxygen saturation was up at that moment in time, the paramedics were reluctant to take him to hospital. Is that correct?
Correct, yes. They tested the two machines, and both of them are the same. So they're saying, well, it's 85%. He says, aye, it's 96 now. And if we take him up to hospital, we'll be bringing him back. They'll just send him back home.
Sorry, apologies. Okay.
4 times they said that.
4 times they told you
minimum 4
if we
times.
take him, he'll just be sent home.
It's up to you, but their advice was that.
What went through your mind at that point?
Well, they're paramedics, and you're thinking, well, you believe in them, you trust them. And that's what we did. Because Lee told them, I'm not fit enough to go up to Air Hospital to be sent back down. I can't, I'm not fit enough, I can't do it. He says, well, it's up to you. He says, here, you sign the document. And they went on their advice, and I'm wishing now we hadn't have, she just says, well, if we no one knew what we knew, then.
You go on in paragraph 21 of your statement to tell us about what the paramedics were saying about the GP. Presumably that the comments about GPs were due to the ambulance having been arranged by the GP. You say that they told you that all the GPs do is moan, that they never come out.
Yes.
Do you think, did they seem My Lord, we're able to continue again.
Very good, thank you.
The paramedic said to us, "Come in, hear this. I'm going to listen to this." So we stood with him. And he phoned the GP. And he says, "I'm just wanting to know, see if you want to come out and see your patient." Mm-hmm. He said, "We've spoken to him, checked him all out, and he's okay. He's 96, we think it's all right for him just to stay at home, and he's wanting to stay at home." Mm-hmm. And I'm going, no. See, you've talked him, is it? And she told him, and we didn't find this out till later on again. Twice then, she says, "No, I want him taken up to Ayr Hospital and be admitted." He says,
My Lord, we're able to continue now.
Right, can I say something? Mr. Dodds, I should say completely understandably, because plainly this is a highly emotionally charged piece of evidence he's giving, has 3 or 4 times now made the mistake of mentioning the name of a relative. And as I say, that's entirely understandable, and he's not to be criticised for doing that. Might I suggest that I'm assuming that most of the material, at least that he's telling you, is contained in the statement you have from him.
Yes.
And to make it easier for Mr. Dodds, there's no reason why you shouldn't lead him through it by simply you yourself reading out the relevant parts and then asking Mr. Dodds if he agrees or disagrees with it, which means that what he has to say is limited. Do you follow what I'm saying, Mr. Dodds?
Yes.
Does that sound like quite a reasonable idea?
Go for it.
Good, thank you. On you go, Ms. Brown.
Thank you, my lord. You had just told us what the paramedic had discussed with the GP. At that point, their conversation seemed to just be around the GP coming out. Did they give you any reason for that? Clearly, your GP had said your son must be in hospital. Did they tell you what they were expecting the GP to do if she came out?
No.
No.
The paramedics never says what she said. Nobody did.
Yeah. And you say that it was later on that you had found out about that. And you say in your statement that the paramedics at that time didn't tell you that your son's blood pressure was in the range of stage 2 hypertension, that his pulse was tachycardic, which means it was higher than it should have been, and his temperature was a little high as well. And you tell us that you trusted the paramedics, that there was no need for your son to go to hospital. Had you been given the correct, accurate information, would you have taken a different view?
Well, definitely, yes.
Would you have asked for him to be taken to hospital?
I would have, yes. You've not made him go.
Yeah. You go on in your statement to say on the 10th day after testing positive, which was your son's birthday, he had just about managed to sit on the stairs, but he didn't look very good. The family wished him a happy birthday, gave him his presents. Then you suggested to your daughter-in-law that she get him back to bed.
Correct.
And she did so. Now, the following day, and this was just 33 hours after the paramedics had left your son, he was lying in bed with his hands on his chest because he couldn't breathe. Is that correct?
Yes.
Shortly after that, at 3 a.m., your daughter-in-law again called for an ambulance, and this time one was sent.
Yes.
And it was this time arrived quite quickly.
It did, yes.
And when the paramedics arrived, you say in your statement that your son was unable to sit up.
No.
Your daughter-in-law had to help him, had to move his legs and help him get into a sitting up position. His head flopped. He was chalk white.
Yes, terrible colour.
Yeah. And you later learned that his oxygen saturation was all the way down at 69%.
Yes.
He had sinus tachycardia, which meant his heart was beating much faster than normal. And he had a high fever by this point.
Yes.
The ambulance the ambulance was called just after 3 o'clock. It arrived not too long after that. I think you say it took 11 minutes. Paramedics attended and tended to your son. And by 4 a.m., the ambulance got to the hospital, but none of you were allowed to accompany him. You also weren't allowed to attend the hospital separately. Is that correct?
Correct.
Yeah. And you weren't told at the time, but you say that you later found out that on arriving at hospital, he collapsed. He was fitting, shaking and vomiting.
Yes, it was when I got his records through. And I could read through them all.
Yeah.
And I seen that, my heart nearly have stopped.
Is that something you consider you should have been told at the time?
Well, I would think so, yes.
Were you able to keep in contact with the hospital to see how he was doing?
No, through his wife.
Okay. And you say in your statement that you and your daughter-in-law kept calling to find out what was going on, and they kept telling you someone would call back. They kept refusing to answer until you insisted that, no, we want to know what's going on. And at that point, eventually, someone spoke with your daughter-in-law. They told your daughter-in-law that your son required supplemental oxygen, and that they were preparing a bed in ICU. So you went from the situation just over 33 hours before, where you were told he was absolutely fine, no need for hospital. If the GP wasn't coming out, nothing was needed, to a situation where your son was in ICU.
They x-rayed him straight away.
Yeah. And you say that your daughter-in-law was able to text him, so presumably he had his mobile phone with him. You say that he was texting his wife saying, "My lungs are a mess," and he feared what lay in front of him, not knowing if he'd come out of that battle. Your daughter-in-law was then told that your son was to be moved to the high dependency unit at Cross House Hospital.
Yes.
Had they explained why that move was being...
It was they didn't have the equipment to deal with him because he was deteriorating that bad. And they needed 100% oxygen.
Okay. And he was transferred on Friday the 19th of March, which was the 11th day after testing positive. They put him on a high flow rate of oxygen, as well as CPAP, which is continuous positive airway pressure.
He didn't like that.
Yeah,
CPAP,
and that's a form...
Kept taking it off, he didn't like it.
Yeah.
He says, I can't do it. Can't do it.
Yeah.
But they kept with him.
Because CPAP is a form of non-invasive ventilation, so it forcibly pushes air into the lungs, but not in an invasive way. And so, as you said, and you've said in your statement, he wasn't able to tolerate that. You said he kept removing his mask.
He told us he was texting, and he would sometimes do a WhatsApp or a thing, and he would tell us what was going on.
Yeah. And because he couldn't tolerate the CPAP device, they returned him to only having high flow supplemental oxygen. Is that correct?
Yes.
And at Cross House Hospital, the doctors told you that your son's condition was poor and they had never seen lungs as bad as his following the scan they carried out.
And they were very, very worried. We don't know whether he will make this. We'll do our best, but...
You say in your statement that the treatment at Cross House Hospital ICU was perfect, and you couldn't have asked for anything else. They told you the truth all the time. Was being told the truth, being kept up to date, something that was really important for you?
It was important, yes, because they told us to phone any time. I said, no, I'm not phoning any time. I said, we'll phone 3 times a day, morning, afternoon and night. And his wife done it first. She couldn't take it all in, so I took over. But they were coming out with all these big words. And no. So eventually got his cousin, who was a nurse. She spoke to him about it to explain what was going on.
Okay, so she would speak to the hospital and then update the family?
Yes.
Okay. And there came a point where they advised that your son would likely have to be put on a ventilator, an invasive ventilator. I understand from your statement that your daughter-in-law was able to speak to your son via FaceTime before that, and you say that your son was adamant that he wanted to speak to you via some kind of video messaging before being put on a ventilator, and so a Zoom call
was set up. They set up and went to our laptop, and that was horrendous. We seen his face and the fear, and he told us, he says to me, Dad, I don't want to go in the ventilator, Dad, I don't want to go in it. And I had to tell him, you have to, son. And I don't know to this day where I should have. I should have told him, no, don't, because of what you've heard this later on. We told him, let them do it, son.
Yeah.
And it was very emotional. And you can see the fear in his face and the tears starting to come. And we had to tell him, "We son, just do it and go, and we'll see you when you come back out it. They're only going to put you to sleep, son." But he had been Googling about ventilation, and that's why he didn't want to go in it. So eventually we got him. He went on ventilator, I think it was 10 o'clock at night. And as soon as they put him on it, he deteriorated so badly. They called us and sent for us.
That was, so he was put on the ventilator at 10 p.m. that night, the 24th of March, and you got a phone call at 10:30 asking you to attend the hospital.
Yes.
And they wanted to speak with you there.
Yes.
And once you were there, they told you that your son had an air block in his neck,
His neck all puffed up.
a leakage in his lungs.
They weren't sure where it came from. They thought it was maybe his lung, but they still don't know where it came from.
They told you that it was extremely hard to get the ventilator pipe in,
It was, yeah.
and his neck had started to puff up. And you say in your statement that you think the pipe may have damaged his throat or lung as it was put in.
Yeah. Possible. I'm not saying guaranteed, but
Yep.
the way they were telling us.
Okay, that was what they were suggesting. They were implying that that may have happened. So your son had deteriorated quite badly, and at that point...
That day, it was his wife's birthday when we went on it.
Oh, right. So, and on that day, after being told this, finally you, your wife, your daughter-in-law, and your daughter-in-law's mother were all finally allowed in to see your son. Now,
They spoke to us first before we went in, told us everything. When
Yeah.
you go in, you'll be shaking when you see all the tubes, the pipes, all the meters and that. It says, but we're going to have to prone them first, which turn them. He says, so if you give us a minute,
yeah,
he says, we'll go in and we'll turn them first. So that's what they did, and then they came out and we all went in. And we stayed in there for about an hour. And we were talking to him, I was playing with his hair and all that, telling him how much we loved him and just holding his hands and that, but we had our PE on. And then he says, right, he says, we're going to turn him again. He says, and the problem there is, if we turn him again, there is a possibility he could take a heart attack. So if you'd like to just go out and wait in the waiting room there, and we'll come back in and let you know, and you can we'll take it from there. So the turn on come back in, he says he turned fine, he's okay. He said in fact he's actually improved it slightly.
okay.
I said right, so we went back in and spent an hour with him, and then we left.
Okay. And at that point, you say that he was unconscious, but
Yeah.
staff told you that he could still hear you.
Yes.
And you tell us that over the next week and a half, the hospital contacted you with updates, and your
Yes.
son's condition was up and down.
It's up,
Through that.
down, up, down.
Yeah. And then on the 1st of April, late at night, you were sent for again,
Yes.
as Lee James was showing signs of organ failure.
Yeah, it was his heart. I think it was just the heart then. And when we went up, we were there for about 2 hours. But he says again, picked up a wee bit again. And so we left. It was 1 o'clock in the morning.
Okay, so you did attend?
Yeah, we
and
did
you left.
attend. We just
Yeah.
held to his hand and all that, and spoke to him and told him to fight. You fight, son. Fight for this. And that was it. We went home.
Thank you. The following morning, on the 2nd of April, which was the 25th day after he tested positive, you called the hospital to ask how he was, and they asked whether anyone had phoned you.
No, that was the second time. That was the first time. The first one you're talking about now. That was the second time. I'm trying to get the date. It was
So this is paragraph 39 of your statement.
39. Aye.
Yeah.
We'll go back to. I think it was the 1st of April they phoned us.
Yes, that was
Aye.
when they called you to say that
Aye.
he's showing signs of
That was the
organ
1st of April.
failure come in, and you attended.
We attended them, and then.
Yeah, and then the following morning you called, presumably to find out.
I didn't call. They called. I did call.
Yeah.
Sorry, I did call, and they said it's nobody phoned you. I says no. He said, well, I think he's better come up. I says this is it. Not
Yeah.
the end. He said we need to switch him off.
And so the
He says-
four of you
The four,
went back to the
exact same
hospital. And you say in your statement you arrived at about 10 a.m. and you were put in a room so that the consultant could speak to you. And the consultant told you that it was time to let him go in peace, as he could be taking fits in his brain, and multiple organ failure, heart, lungs, kidneys, pancreas, liver.
We're all
Is
failing.
that correct? You mentioned that the staff were all dressed in full PPE in a ventilated room when you saw your son. And the hospital asked if you want to play any music.
Correct, yes.
And your daughter-in-law at that point chose to put on their wedding song.
Their wedding song, yes. Loved you for 1,000 years.
How was that experience for you?
Surreal. You just couldn't believe it. You were looking at him and he was playing with him again, talking to him, holding his hands. But you can see it was time. His were all black and blue, his fingers, everything just changed.
Did it provide any comfort to you knowing he died with his family
Oh,
by his
definitely,
side?
aye. And they were great. They tell us what we wanted.
Yeah. You go on to talk about his funeral arrangements. You say that only 20 people were allowed. Both your daughter-in-law and your son have big families, so it was difficult choosing
Very,
people.
Yeah.
But the full street route to the crematorium was lined up all the way for your son.
His house, all the way over to our house, and then up to the crematorium. Full roads. Never seen it before. Only seen it once before. Aye. But it was.
Did that mean
gave
a
you
lot
some,
to
that
you?
helped. Yes, it did.
Mr. Dodds, I've just been told that you have breached the restriction order 5 times, and I've been told that if that happens, then I am obliged to tell everyone that it's actually your birthday today. So happy birthday.
Thank you.
All right. I'm not sure what to make of that, but my happy birthdays as well, thank you.
Don't ask the number.
Mr. Dodds, I think also what we've done is that in the slightly longer gap this time, we've prepared a redacted copy of your statement in which the names have been taken out. Now, we were actually doing fine for a while there when you were simply answering the questions.
I can't say my wife.
We are now ready to continue, Lord Brailsford.
Right, thank you, Ms. Barami. Just a minute before we start, though. Mr. Dodds, as I said before, I appreciate this is a difficult thing for you to do, and that's entirely understandable, and you've not to worry about it. But we were doing fine for a while there. As you know, you've given a very full statement, and for a fair passage there, Ms. Barami was asking you questions, I think by and large quoting directly from your statement to make sure we had what you had said, and you were effectively answering yes or no with a little elaboration. We're going to continue to do that, so let's try and keep your answers terse. Obviously, if you think she's misquoted you or she's got something wrong, that's different. But basically, see if you can assent or dissent to what she puts to you. Okay?
Thank you, my lord. Now, moving on from there, you made a number of complaints following your son's death. You tell us you made some parliamentary complaints. You complained to the First Minister, then Nicola Sturgeon, to Jason Leach and John Swinney, as you believed that the Scottish Government, that had the Scottish Government opened up schools later, your daughter-in-law wouldn't have been around her colleagues and pupils, so your son may still be here. Now, I am just summarising these because, you know, we have these and we will take them fully into consideration. You also made a complaint about the ambulance service and the assessment unit, and during your evidence, you have commented on those points, being the refusal to take your son to hospital, refusing to provide treatment, sending him home from the assessment unit. You go on at paragraph 58 then to say that you believe that had the paramedics listened to your daughter-in-law when she told them how unwell your son was and had taken him to hospital at that point, you believed it could have saved your son's life.
Correct.
Is that still your position?
It still is, yes.
And is that a thought that regularly occurs to you?
Every day.
Thank you. Now, I want to move on to the effects that this has had on you and your family. Those are contained in paragraphs 64 to 72. I appreciate that my intention had been for you to speak to those effects, but given how difficult this is to recount, and especially the effects, I would propose to read these out myself, yes, if you agree with that.
Totally.
And I'll ask you to confirm each point after. And once I do that, I'll then ask you whether there's anything you would like to add at that point before we finish.
Okay.
Are you happy with that?
Yes, I'm happy with that.
Thank you. Okay. So you say at paragraph 64, our lives have been totally destroyed since our only child passed away on 2nd of April 2021, made worse by the professionals that could have done more to save him. In that, I mean First Minister of Scotland for the mistakes she made, the COVID-19 assessment units at cross-house hospitals, who in our opinion didn't do their jobs professionally and stuck to their so-called guidelines, protocols and ticking boxes. The Scottish Ambulance Service paramedics for not doing their job professionally, and also when the GP doctor told the paramedics what she wanted them to do with my son and not taking him to the University Hospital Ayr COVID-19 assessment unit. 3 times they were told to admit him by his GP, and the hospital were waiting on him arriving. Is that correct?
That is correct.
And
yes.
is that still your position?
Still my position.
Thank you. At paragraph 69, you say, I don't really want to be here, but I know we need to be for the kids. My wife is the same. I am so angry, and it is this that keeps me going. Every day is Groundhog Day, the same as the day before, over and over again. All the information was right in front of them all, but nobody took the action of doing the professional jobs they were trained for and admit him for at least 24 hours observation or an X-ray. That is what is destroying our lives, because we know what should have been done and nobody stood up to the task of making the right decision. Crosshouse CAU, ICU received your son too late because of the assessment's failure to see how ill he really was, because we see how he was struggling, and it was all down on the on-call doctor's records. Apologies, that was paragraph 65, not 69. Is that still your position?
It still is, yes.
Yeah. At paragraph 66, you say that your son is in your mind every day in life on numerous occasions. You can't stop it, and you wouldn't want it to stop either. Lee James was our world, our beautiful son, my best friend, a loving father, and he was a devoted husband. To us, that makes Lee James the perfect, loving son. He was ripped away from us by people in power who take the credit when it is going, but will hide the evidence, lie, or say nothing that will incriminate themselves when they know they done wrong, and hold back any internal inquiry findings like the Scottish Ambulance Service are doing to us now. Even though we are still grieving, they will not give us the documentation we ask for. They would rather help their job title, their workmates, and their work's reputation. They are told by their hierarchy bosses, who do not care for the truth to come out, who do not care about for the truth coming out. Well, it will come out, I can assure you of that. Until my last breath, I will fight for my son for justice. Is that still your position?
Yes.
Thank you. At paragraph 67, you say, sometimes I find myself going to throw something at the TV and have to stop myself with the anger inside myself. When you get the First Minister, Nicola Sturgeon, who broke the rules she set for the population, and probably more than we know, a woman who was so determined, whose only thought was to get independence for Scotland and get her name in the history books, now is the woman who destroyed Scotland, in my opinion. Her mistake was always having to make Scotland COVID-19 rules set before Prime Minister Boris Johnson to make her look good. When First Minister Nicola decided to restart the return to the classroom on 22nd of February 2021, she alone signed my son's death certificate. My daughter-in-law contracted COVID-19 before the UK schools and nurseries reopened on the 8th of March 2021. My daughter-in-law tested positive on Sunday the 7th of March 2021. UK schools and nurseries returned on Monday the 8th of March 2021. My son tested positive on the 8th of March, and my grandchildren tested positive on the 9th of March 2021. That works out that if the First Minister of Scotland followed the rest of the UK, my son would still be here today with his loving family and giving us the love he gave us all. To me, that is corporate manslaughter, as she knew there would still be serious illness and even death. Is that still your position?
Yes, definitely.
At paragraph 68, you say, I have been to both meetings for the Scotland COVID-19 inquiry in Edinburgh, November 22 and May 2023. In both meetings, when I asked a question of the behaviour of the paramedics, telling your son that the doctors in hospital would just send you back home, I was approached by 3 other attendees at the 2 meetings that the same happened to them as well, about being sent back home. So a question has to be asked. Had the Scottish Ambulance Service hierarchy told paramedics to advise patients that they would just be sent straight back home by the doctors or hospital, and to follow instructions from their superiors in trying to talk the patient out of going to hospital if their stats are okay? And again, that is corporate manslaughter. Is that still your position?
Yes, it is, yes.
At paragraph 69, you say both your grandchildren were helped by Bernardo's. A woman, presumably from Bernardo's, would come to the house to see them. Your granddaughter, because she was young, was clinging to her mother and had to change, I think, schools to be with her mum at the school where her mum taught, where she worked after returning in August 2021, and she actually had to move nursery as she couldn't go to work in the nursery where she had caught COVID, which eventually took the life of her husband. Your grandson, who had seen... He was more affected by the death of his father. He has ADHD and has gone off the rail quite badly, like walking out of school and going up to see his dad's grave as it is just down the road from his school. I'm always up at the cemetery 3 times a day and find your grandson at his dad's grave. He just doesn't care what he does. I say he is a lost soul just now, and he is really suffering badly. Your grandson has had several meetings with the school. Bernados are trying to help him, as I am the only one he can talk. I'm trying every way to help him get through life just now, but he has changed a lot since his dad passed away. Is that still your position?
Yes.
Paragraph 70, you say this should never have happened to your son. He should still be here today with his family. It is always sad when somebody loses a loved one, but when it is your only child and you're left without the most important, treasured person in your life, there is no way of coming back from that loss. You're left with just memories, pictures and videos every day for the rest of your life. It is a horrific feeling every day and hard on your everyday life to cope. I can honestly say it should have been myself. I would have taken my son's place in a second. Is that still your position?
Yes, gladly.
In paragraph 71, you say, the way in which my son lost his life, the mistakes, the lies, the poor decision-making, and also trying to hide the documents from us as a family still in grieving as a result of all those so-called professionals has made me so angry, upset, devastated every day. And the anger inside me is horrendous with my son's passing. We have no life now. Nothing we want to do or go to except the cemetery. This is a full-time job for me, seeking justice for my son. My wife feels the same way and emotionally destroyed. I'll always hear her sitting, sniffling away and going to bed and crying herself to sleep. And there's nothing I can say or do that will stop her. Just look after her as we both feel the same. Is that still your position?
Yes.
Thank you. And finally, in paragraph 72, you say that your son was an amazing dad, an amazing son, and an amazing best friend. He and his friend called me the Oracle, as he would say, I'll phone my dad and ask him, he'll know. He had a massive impact on everyone he met. I miss him so much that every day hurts me so badly. I can't believe that he is not here now, or I won't accept it, because I talk to him every day in life at the cemetery, 3 times a day, and nobody will tell me different. That is my way of dealing with what is going on in my head and will not change. Love you, son, from Mum and Dad, always together till we meet again. And there are 4 X's at the end there. Is that still your position?
Yes.
Thank you. Now, is there anything that we've not covered that you would like to add?
No, nothing.
Okay. Thank you very much for taking the time to attend today.
Okay.
And for providing your evidence.
Yes, thank you very much indeed, Mr. Dodds. I'm happy to say for you that that's the law. Very good. We'll adjourn until tomorrow. Thank you very much.
Thank you, my lord.
There you go. No, I never stay.